I'm Dr. Ravi Teja Rudraraju, consultant knee and sports medicine surgeon at Apollo Hospitals, Financial District, Hyderabad. First of all, wishing you a very, very happy Women's Day, all of you. And it's a privilege and honor to kind of present today to talk about more about women's health, particularly in the field of orthopedics. As you see, more people suffering from joint pains these days, and also I think a lot of women suffer from osteoporosis. So I'm here to talk about bone and joint health, and more importantly about osteoporosis in women. As we know that we see different age group of women suffering with different orthopedic problems. If you start with adolescent and young women, more importantly, if you see this very common incidence of knee pain of people around of women around say maybe 20 to 40. So the most common reason being chondromalacia patellae. So chondromalacia patellae, when we call it as softening of patella. So the undersurface of kneecap has got some cartilage like you have in the knee. So as and when it progresses to have some kind of wear and tear, it leads to pain. So usually women of that age present to us talking about pain while going up and down stairs. Also, they complain of pain while doing their regular chores. So mm, the main important reason for knee pain, more importantly around the kneecap, is because of weak knee muscles. So it's very important to identify whether there is any softening of patellae, that's called as chondromalacia patellae. Generally, on examination, we get to understand by few tests that we do, and if we suspect there's a chondromalacia patellae, if it's not that severe, we advise women to do good strengthening exercises for the knee, also do cycling. And also, similarly, we will request them to get an MRI done if it in case doesn't subside. So more often, patients also get better, and they don't really kind of suffer through a long time. But in case if it persists, then we explore sometimes along with physiotherapy injections such as PRPs and hyaluronic acid. But just to make sure that you understand it right, it's just because of the weak muscles, and it's important to kind of keep your muscles strong around the knee. The second problem that we see around the same age group is vitamin D deficiency. But to be honest, vitamin D deficiency is now seen across all age groups, not only in women, also in men. But more importantly, we see in women. So the reasons could be because of indoors, more importantly, and the kind of consumption of calcium that you do. So it's important to get your vitamin D and your calcium levels checked. In case if there is deficiency, it's important to start with the vitamin D supplementation, and also it's important to take vitamin D supplementation along with sun exposure. So morning walk or morning exposure to sun around 8 to probably 10:30 in the morning is a good vitamin D absorption optimization. So that's a very important thing that we need to remember in young women. When it comes to middle age, you get to see a lot of women talking about joint pains. Also, some women also mention around the same age group talking about small joints, pain around the small joints. Also, they kind of mention about uh, again, knee pain is one of the reasons that they mention. Similarly, they also talk about overall, pain across the body with different bones, like say legs, thigh, or maybe back. Again, down that same age group, it's very important to understand uh, vitamin D again plays a bigger role. Vitamin D deficiency and calcium deficiency could be one of the big reasons why women suffer with joint pains as well as bone pains. Similarly, it's very important to rule out rheumatoid arthritis around that age group. As mentioned, in the middle-aged women, if they have a significant family history, like some of their relatives or probably their mother or father who had a history of rheumatoid arthritis, definitely that could be one of the important consideration that we should look at. So multiple joint pains, morning stiffness, then swelling and redness around small joints, particularly fingers and all that. Similarly, knee pains, and as we kind of see through the day, it gets better. More likely, it could be uh, definitely uh, rheumatoid arthritis. So it's important in that consideration, we need to make sure that they get rheumatoid workup done, like RA factor, ESR, CRP, and complete blood picture to make sure that they are not dealing with any rheumatoid arthritis. And when it comes to old age, particularly post-menopausal women, say women of around, say, more than 45, more than 45 to 60. So, I think these people definitely kind of suffer through uh, something called as uh, post-menopausal symptoms such as vitamin D deficiency, hormonal changes, plus osteoporosis, again osteopenia and osteoporosis. So it's again very important to make sure women around this age will have to undergo thorough workup for their bone density, like DEXA scan, which is very important. Also, in women who have got symptoms like endometriosis that we see probably around middle-aged or probably younger women, also have a significant risk of osteopenia and osteoporosis. The reason being, when they are on hormone replacement therapy, the side effect of these medications and this management could lead to osteoporosis or osteopenia. So usually women complain of back pain or joint pains, or can be bone pain. But most often, women complain of bone pains, like it indicates like vitamin D and calcium deficiencies. So as mentioned again, it's very important to make sure that we're screening it. In our practice, we have seen a lot of women coming to us around different age groups who, for instance, get a DEXA scan done. Most of them will have osteopenia, if not osteoporosis. So, as you know, osteopenia means weakening of your bone, and it's very important to correct it. Otherwise, it will increase the risk of a fracture in the old age group. And obviously, in the early, younger and the middle-aged women, it's might lead to fatigue, pain, and difficulty in doing your regular work. So similarly, women of around above 50 and 55, again, what we've seen in research is that generally female population are exposed more to osteoarthritis, and they might have more knee pains. So again, it's very important to kind of make sure that you're keeping your knees strong, keeping your life active, like walking every day, exposing yourself to sun, and also making sure that you are getting your screening done in the right time. So in all sense that we try to kind of give you a structured plan wherein you're working on yourself, building your muscles, keeping yourself fit, taking the right supplements like doses and in the appropriate times and intervals, and also making sure that you're not increasing yourself to the risk of a fracture or any untoward incidents. So just listed down different age groups with different possibilities of conditions that you go across. But over and above, it's very important that whenever there are symptoms such as pain, unresolving pain particularly, similarly, if you are not so active like before, and you had an injury and it's not resolving to normal, so it's important to see a specialist and make sure that everything is going right. Because as you see, the bone is one part, but there are other components such as ligaments, meniscus, and soft tissues, tendons. So one of the very important recent silent epidemic that we are seeing in the orthopedic space, particularly in the women, is that women of around age 45 to 55 who experience sudden pain in the knee after a twist or after trying to go up or downstairs or trying to walk, um, could be a root tear, which is your meniscus root tear. So meniscus is a very important structure in the knee, which we call it as shock absorber, right? So this tear usually happens in the origin or the insertion of the meniscus to the bone. Once it is torn, then the whole of meniscus becomes dysfunctional. So as you know, this meniscus becomes dysfunctional, and obviously the whole weight will fall onto your knee, leading to a lot of pain and a lot of swelling. And most of the patients say us that they're in terrible pain and they want to get a surgery and as immediate as possible. But the key here is that it's because of the root tear. And most often, if you repair the root tear through arthroscopic surgery, you preserve your knee for next 30 years. It not only prevents the future arthritis, it also prevents the pain and swelling which you are going through as of immediately. So again, women of around the age of 45 to 55, if you have any of these symptoms, don't ignore it. Make sure you see a specialist, particularly a knee specialist, who can diagnose this condition as a root tear and immediately offer you a solution which can fix it, not only for today, but also for your tomorrow, wherein you're preserving your joint. So, in a sense, we have covered the bone and joint problems across different age groups in women, plus the pertinent conditions like deficiencies in terms of vitamin D or calcium, or probably in different conditions like rheumatoid arthritis and endometriosis and etc. etc. But more importantly, the meniscus tears that we're talking about. With this, I would like to stop here to make sure that I have few questions from your side. But again, I think it's important to seek the specialist whenever there's a problem than really delaying it or kind of ignoring it, because it might lead to a bigger problem. So let me see a few questions here. I've got Priya who was asking that, what to do with vitamin D deficiency. So yes, so the deficiencies can be categorized as mild, moderate, and severe. Mild, moderate, severe, right? So in case of mild to moderate deficiency, we often give some supplements like vitamin D and calcium for a course of 3 months. Like you have got a lot of available options like Uprise D3, Tio 60K, like different providers give this vitamin D3 and all that supplementations. So you take it for 3 months, once weekly, and also take calcium every day, because vitamin D helps you to absorb calcium into the body, right? So that's very important. There's another question about osteoporosis from Gayatri. What is osteoporosis and how to manage it? Yeah, as mentioned, osteoporosis is weakening of your bones. Your bones become weak and fragile, which can lead to fracture. That happens because in the bone formation, there are osteocytes and osteoblasts. So one is trying to put the bone in, the other one is trying to remove the bone because it needs to model the bone. That's how the bones are formed in the beginning. But in case the calcium is losing out in the bone or the bone is resorption, so in that case, your bone becomes weak. That happens because of aging. That happens because of your hormonal condition, like in conditions like endometriosis and other things. So over and above, I think it's important to diagnose the condition by a DEXA scan, which is very precise. You get the DEXA scan for your wrist, hips, and back and see how where are you osteoporotic or osteopenic. Accordingly, we have got medications like teriparatide, denosumab, zoledronic acid. Different medications are available, which you take it for 2 to 3 months, and it should get you back to normal. So with that, I'll just conclude my session here. But I'm very happy and very thankful for presenting this topic on Women's Day. And again, I wish you a very, very happy Women's Day. And I request you to take care of your health well, because you are the support to any family. you be a daughter, be a mother, be a grandmother, you have a major role to play in the society. So I wish you have strength. I wish you all the health and happiness. In the same time, I want to make sure that you're also doing well in your life. So thank you so much.